Hi, families. Thank you so much for joining me today with regards to learning about parent-child interaction therapy at Amygdala Co. Today, I'm going to talk about the families who might be a good fit for Pcit, what Pcit is, the services that Amygdala offers specifically, and then we'll end with any questions that you may have. Parent-child interaction therapy is an evidence-based therapy that was developed by Dr. Sheila Iberg. It has been researched across the globe at different research institutions. Our clients are Missouri and Illinois families with children between the ages of 2 and 8 years old who have what's called externalizing behaviors. So anxiety, ADHD, depression, defiance, acting out, inattention, talking back, et cetera, and their parents and caregivers are also involved in the therapy. Therapy lasts approximately 12 through 24 weeks. So during weeks 0 through 9, there's a pre-treatment and family assessment. And I'll go over that in just a second. And then we have what's called child-directed interaction, where feedback, teaching, coaching, and weekly assessments are given. Then weeks 8 through 24, we have parent-directed interaction. Again, this is teaching, coaching, and then also discipline techniques come into play here. And then at the end, we have therapy graduation and post-family behavioral assessments. The psychological assessments / behavioral assessments that are given to families are the Autism Parenting Stress Index, the Pediatric Symptom Checklist, Therapy Attitude, Adverse Childhood Experience, and of course the FB, in addition to other psychological surveys that are given at the company. At Amygdala, there are 3 ways to receive Pcit. The first way is in the office. So families can go directly to the office and the clinician will meet you there and provide parent-child interaction therapy. The next way is in the home. So the family is in the home and the therapist drives to the home and provides parent-child interaction therapy. And the third way is shown on the screen. And this is our main way. The family is in the home and the clinician is in their office. The parent or caregiver has a Bluetooth in their ear, and the clinician is speaking directly with the parent and caregiver. And so this is called remote live coaching. In this way, the parent gets to teach the child new skills. So the clinician passes off skills to the parent, and then the parent passes off skills to the child and also learns new ways of reducing and preventing outburst and defiance and hitting and kicking and behaviors that we don't want to see as much of. This remote live coaching really emphasizes the point that we want to give power to the parents. When the clinician leaves, we want the parent to be able to reduce or prevent the behavior that we don't want to see. So shouting, kicking, hitting, biting, etc. So how it works is that during therapy, parents are taught new skills and also are not allowed to do a couple things. So this is just during therapy. Parents are not allowed to ask questions, give commands, or talk negatively. So for example, parents are not allowed to say, what are you playing with? Do you like this? Those are questions. They're also not allowed to give commands. Watch this, sit there, go here, etc. And they're also not allowed to talk negatively. That's not smart. Do a better job. Shut up, etc. So we tell parents what they're not allowed to say. What are parents allowed to do during therapy? Parents are going to work on what's called pride skills. So Pride. P is for praise, and I'm going to go over what that is in just a second. R is for reflect. I is for imitate, D is for describe, and E is for enjoy. The next slide is a bit much. At the same time, stick with me and it should make sense. So we're going to start with the praise. Parents are taught ways to praise their children that helps increase attention span, reduce unwanted behaviors, lets children know that they're paying attention, lets parents model new ways of dealing with behaviors and interactions. So for example, parents can say something like, I like how quietly you're playing today, or you did a great job building the tower. So when that is said during the task that it's happening, so the child is building a tower and we say, you're doing a great job building a tower, that's providing support, that's showing the child that we're paying attention because we see what they're doing. And that's also teaching them vocabulary because we are saying the sentence out loud. You were doing a good job building a tower, and they hear the way that we say that to them. And then it's also support. They're building a tower, great job. And then also parents are taught to reflect. The child says, I'm building a tower. Parent could say, you're building a high skyscraper. And so what that does is it shows the child that the parent is listening because they essentially repeated what the child said. At the same time, the parent added in a new word, skyscraper. So that's teaching a new word without being super pushy. It's just more in casual talk. And again, we're also teaching children to mimic our speech because we are saying you're building a high skyscraper, so they could potentially say it back to us in the tone and inflection that we say it. Parents are also taught to imitate. So the child is building, the parent is building. The child is coloring, the parent is coloring. During therapy, the parent is engaged in the activity that the child wants to do in a creative play activity. And describe. The child is building, for example. The parent could say, you're putting the yellow block on the yellow block. So describing exactly what the child is doing. This does a few things as the other ones do. This shows the child we're paying attention, allows the child to focus more because they can, oh yeah, I am putting a yellow block on a yellow block. This allows us to calm down and be in the moment so we can have more attention in the moment and recognize more positive behaviors that are potentially happening in that moment. And of course, enjoy. So smiling, engaging, paying attention, learning how to enjoy everyday interactions. So children also learn how to enjoy everyday interactions. This is a video example of Pcit coaching. This is not at Amygdala. At the same time, there's not a lot of examples on the internet. Because of HIPAA. This is a pretty good example of what Pcit could look like for you and your family. If we watch the video, we see mom has a Bluetooth in her ear and she's being coached by this clinician during her time with her kiddo. This is an example of what an in-office Pcit suite could look like. This is not at Amygdala. It's still the same concept at the same time. So the side that we have the chairs, this is a one-way mirror. So the clinicians can see out, but the family can't see in. And then the family is over in the play area. Mom again, or dad, or the caregivers have a Bluetooth in their ear, and they're listening to the clinician coach them through interactions. During Pcit, parents are trained to act as agents of change by learning to model positive behaviors for their children's behavioral or emotional difficulties. Some outcomes of Pcit is less personal distress as child behaviors change. As child behaviors decrease, everybody feels a little bit more at ease. Improvements in parenting interaction style. So parents are taught new skills and new ways to interact with kiddos, reduce behaviors, prevent behaviors, et cetera, et cetera. High levels of parent PCIT satisfaction because parents now have the skills. A clinician can lead the home and the parent knows what to do. And of course, clinical elimination / reduction of behaviors. So clinical elimination does not mean that a child won't get upset every now and again. We all have our moments. At the same time, significantly reducing ADHD and outbursts and tantrums to almost non-existent. As a recap, parent-child interaction therapy is an evidence-based therapy that lasts between 12 and 24 weeks, family dependent. Parents learn new skills to reduce behaviors in real time. Live coaching is a huge component of PCIT. Weekly behavioral data is collected regarding kiddos and behaviors. So important to see unwanted behaviors reducing on paper, in addition to reducing in the home. And parents are taught new skills that they are required to spend a little bit extra time with their kiddos practicing these skills. This is the whole point of therapy. This form of therapy is giving the parents the power. Thank you, families, so much for taking the time to listen to this video. And we look forward to serving your family at Amygdala Co. If you have any questions, please drop them in the chat or comment section below, or reach out to us, send us your questions. Thank you so much and enjoy your day.